Hello, everyone. Today we are going to talk about exercise and diabetes. What is diabetes? Diabetes is a disease that causes high blood sugar levels in the body. This can be due to one of two things, either the lack of insulin in the body or from the body developing a sensitivity to insulin. And while no type of diabetes is genetic, your DNA can potentially put you at a higher risk of developing it sometime in life. Diabetes is a major problem throughout the United States, and according to the CDC, it affects over 34 million Americans. That is almost 1 in 10 Americans who suffer from this disease. One of the reasons that diabetes needs to be taken so seriously is due to the fact that it is the seventh leading cause of death in the United States. It subjects you to higher risk for a multitude of health issues that we will talk about later in the slides. There are three major types of diabetes. These are type 1 diabetes, type 2 diabetes, and gestational diabetes. For this presentation, we are going to be focusing on the first two types. So the first type of diabetes that we are going to talk about today is type 1 diabetes. This specific type of diabetes is an autoimmune disease that causes the pancreas to produce no insulin. This occurs because the body attacks the beta cells in your pancreas that produce the insulin. When the insulin is not produced, the blood sugar levels in your body are not regulated and begin to rise. Typically, this type of the disease is identified in childhood or adolescence, but adults can be diagnosed with it in some rare cases. This is the least common of the three major types of diabetes and only affects around 5 to 10% of people with diabetes. Unfortunately, there is no cure. Insulin injection treatments are typically what is given to a patient who suffers from this type. However, research has shown some results in terms of exercise helping patients with type 1 diabetes. The other type of diabetes that we are going to discuss today is type 2 diabetes. Type 2 diabetes is a chronic disease that affects how the body processes or regulates blood sugar. It begins to occur in people when their body starts to develop a resistance or sensitivity to insulin, and can also occur when the body stops producing insulin altogether. This is the most prevalent type of diabetes in the United States and makes up around 90% of cases in this country, according to the CDC. Some of the risk factors of diabetes are high blood pressure or hypertension, poor nutrition, obesity, family history, among many others. This type of diabetes is widely believed to be lifestyle driven and can be mainly prevented by living a healthy lifestyle and exercising regularly. If a person develops type 2 diabetes, they can use a well-developed exercise regimen along with a nutrition plan to help combat the disease. There are a wide variety of symptoms that one can experience as a result of diabetes, according to the CDC. If you experience these symptoms over time, it may be necessary or in your best interest to see a healthcare professional. Some of the side effects that obesity can cause are extreme thirst and constant hunger, blurry vision that is caused by high blood sugar levels, fatigue and irritability because the body is unable to bring glucose from the blood into the cells throughout the body, or even weight loss because glucose is not being used for energy and instead the body is using fat and muscle. Next to this is a chart that also displays symptoms of diabetes, such as infections, numbness in hands and feet, as well as frequent urination. Diabetes is a disease that can not only have negative symptoms but negative health effects as well. The health effects can lead to detrimental things occurring in the body that can lead to worse disease or even death. It is important to address these as soon as possible in an attempt to prevent the worsening of the disease. Some of the various negative health effects that are associated with diabetes are damage to both small and large blood vessels. This can lead to improper transportation of blood and nutrients throughout the body. Nerve damage can also be a negative effect, which can cause issues because it can increase one's risk to injury. High blood pressure also can result from diabetes, which can lead to worse overall cases of cardiovascular disease. It can also damage the pancreas over time, which can prevent the pancreas from completing its necessary functions throughout your life. There is no cure to diabetes. However, there are many effective ways that one can treat their case. These treatments can better a patient's condition and make their life more sustainable. One of the most common ways that someone monitors or treats their diabetes is through the use of a glucometer. This glucometer measures glucose levels. Another way that one can treat diabetes is through changes in their diet and eliminating bad foods from it. Increasing their fruit and vegetable intake, as well as lean proteins, can be especially effective in helping with the disease. Lastly, by using exercise, one is able to treat the disease, and this exercise, in turn, can lead to weight loss, which can further lead to greater health benefits. As stated in the previous slide, there is no one cure to diabetes. However, we can use different treatments that can improve one's condition and better their overall case of the disease. One of these treatments is exercising regularly. Exercise can be either moderate or vigorous, but should be done on a consistent basis. It is greatly associated with positive health impacts for diabetic patients. One of these benefits is that it improves the body's sensitivity to insulin. This makes it easier for the body to regulate glucose inside of it. The glucose levels will be lowered due to this change in insulin sensitivity. According to Harvard, it does not matter what type of exercise that you do, as all forms are effective at lowering blood glucose levels. However, aerobic exercise and strength exercise should be included in one's regimen at all times, as this will lead to the greatest health benefits. Exercise is one of the most common strategies used to combat type 2 diabetes. When one combines this with a healthy diet, it can promote a healthier and more sustainable lifestyle that will lead to greater health benefits. This study on this slide analyzed different programs that had been done with diabetic patients and came to the following conclusions. They found that exercise positively affected the pancreas's ability to produce beta cells, which in turn could produce insulin. This would lead to greater regulation of glucose in the body, which could in turn decrease blood pressure. They also found that exercise increased glucose and fatty acid oxidation in muscles and decreased adipose tissue in the body. The figure to the right of this slide illustrates it all, as you can see. They have exercise in the middle and all of its positive health effects surrounding it. The study also listed the American Diabetes Association recommendations for diabetic patients wanting to exercise. The American Diabetes Association states that an exercise regimen should include aerobic, resistance, and flexibility training all together for the greatest results. The same study went into more detail for each of the exercise categories. The American Diabetes Association states that aerobic exercise should be completed 3 to 7 days of the week without any consecutive days of exercise. Shorter duration bouts of vigorous exercise, around 75 minutes per week, is adequate for younger and more fit individuals. High-intensity interval training can also be completed. For resistance training, this should be completed 2 to 3 times per week and should be of moderate or vigorous intensity. The sessions should compose of 8 to 10 exercises for 1 to 3 sets of 10 to 15 reps each. Flexibility and balance training should also be included around your workouts. These sessions should be done 2 to 3 times per week, or when needed. The study concluded by stating that using all 3 of these things together would provide the greatest benefit for each individual patient. It has been found recently that people who live healthier lifestyles are less likely to develop blood glucose tolerances or issues such as diabetes. These lifestyles are better in terms of exercise and dietary patterns. A study found similar results to that of the one included in the previous slide, and this took place in the Mazandran Medical Science University and consisted of 62 participants. The participants were divided up into a control group as well as an intervention group, and the intervention group was given a daily exercise regimen. The control group was not, and the exercise regimen was of moderate to vigorous intensity. The researchers found at the end of the intervention group members had significantly lower levels of plasma insulin and glucose uptake was promoted in the body. This shows a positive relationship between exercise and diabetes and shows why it's so commonly used as a combatant to the disease. We will now move on to our test question, which will test what you have learned today about diabetes and exercise. The question is as follows. Zachary is a college student who has been newly diagnosed with type 2 diabetes. What are the American Diabetes Association recommendations for aerobic exercise for people diagnosed with type 2 diabetes? A. 2 to 5 days per week of 120 minutes of moderate physical activity, or 2 to 3 days of vigorous physical activity for 60 minutes a week. B. 2 to 5 days per week of 150 minutes of moderate physical activity, or 2 to 3 days of vigorous physical activity for 70 minutes a week. C. 2 to 5 days per week of 120 minutes of moderate physical activity, or 1 to 2 days of vigorous physical activity for 60 minutes a week. or D, 3 to 7 days per week of 150 minutes of moderate physical activity, or 2 to 3 days of vigorous physical activity for 75 minutes a week. Pause this video to answer the question before moving on to the next slide with the answer. If you answered D for the previous question, you were correct. The answer is 3 to 7 days per week of 150 minutes of moderate physical activity, or 2 to 3 days of vigorous physical activity for 75 minutes a week. These are the citations included in this presentation.